To be from Tokelau, you are rooted, You're not flying in the air, like a lost bird, You know that you have a home.
Home, community and family are all things that Tokelauans deeply value. Unfortunately, the current state of healthcare in Tokelau sometimes forces members to stray from home, from family, across the ocean to seek sufficient medical care. Home to 1,500 residents, Tokelau is made up of 3 island atolls. Primary healthcare is available minimally, with 1 clinic on each atoll. Access to essential and specialist healthcare is one of the most significant challenges islanders face, with an insurmountable strain on the existing system due to limited professionals and resources. Lack of education and an influx of westernized behaviours have resulted in a high prevalence of non-communicable morbidities, the most common being cardiopulmonary disease and diabetes. Public health efforts have currently instilled community-based preventative plans to improve the overall health of future generations. However, a gap still exists within direct management and monitoring of prevailing illnesses on the island. Without effective management of current diseases, patients deteriorate, and this imposes further pressure on the already fragile system.
Given the ease of acute exacerbation of cardiopulmonary conditions, a sustainable diagnostic and monitoring solution would reduce the otherwise avoidable expenditure of vital intensive care resources. With only 2 ventilators accessible by boat and shared with the Samoan population, diagnosis, management, and monitoring is essential to mitigate emergency resource exhaustion. One of the most fundamental diagnostic tools not readily available in Tokelau is a spirometer. Spirometry allows medical professionals to measure the flow and volume of air entering and leaving the lungs. The absence of spirometers are a result of the island having poor access to training, lack of technical support, and restricted human and financial resources.
Our solution is inspired by the Samoan proverb, "Oletatai awa fua," which refers to the new dawn. Not only is this device an innovative approach, which is depicted by its name as giving new life with autonomous health management, but betters the lives of many by reallocation of essential resources. The New Dawn was also chosen for its play on words, with the device requiring users to implement upon rising for more accurate reading. The spectrometer consists of the adrenal board, a pressure sensor, and biodegradable tube and casing. The spectrometer internal technology can be manufactured in conjunction with local Asian Pacific companies such as the New Zealand company Medical Devices and Testing. The external components, a disposable biodegradable mouthpiece and casing, can be made from agricultural waste products that have been sourced from local farmers. Using bioresin from banana sap as an adhesive and sealant, and coconut fibers for structural rigidity, these components will aid in the reduction of resource consumption and help to strengthen the long-term plans of agricultural waste recycling. So how does it work? Those who are currently diagnosed with chronic respiratory diseases will be provided a spectrometer at the discretion of their doctor. Patients will be able to run tests in the comfort of their homes. The adrenal component will allow test results to be sent via Wi-Fi, which allows medical professionals to monitor data and implement timely intervention strategies. Transmitted data to remote or local specialists can be achieved by programming the adrenal to save and store data to the cloud. The use of cloud computing and the completion of the undersea fiber optic cable will create optimal conditions for future specialist telehealth programs.
The benefits of this solution will be experienced by not only those with chronic respiratory illnesses, but will also take the pressure off the healthcare system to allow for more accessible and equitable treatment. The benefits to the individual directly expand much further than just health, also extending to economical and social cultural benefits by avoiding travel costs and being able to stay on their home island whilst receiving sound treatment. To ensure a successful implementation of this strategy, education on how to use the spirometer effectively is critical. Strategies include collaborating with local artists to create visual aids on how to appropriately and accurately use the spirometer and recycle the mouthpiece, as well as partnering with the Council of Elders in each village, specifically the resident doctors and Director of Health, to be advocates for the strategy. So how does this meet the Sustainable Development Goals? Spirometers can aid in the diagnosis, monitoring and management of cardiopulmonary related diseases. The earlier the diagnosis, the sooner a treatment plan can be implemented to prevent the disease from progressing to a fatal stage. Job opportunities will be generated by locals manufacturing the mouthpieces, as well as collaboration with local farmers, which help to stimulate economic growth and strengthen community engagement. And sustainable sourcing of agricultural raw materials from Tokelau farms will ensure that the mouthpiece will be 100% biodegradable.